This is an example of the reason I came to Libby. At that time, it was a very striking contrast to what we had seen even in national parks. It's an area that just offered so much in the outdoors, and for people that appreciate those activities, this was just perfect. I feel very fortunate to have all these beautiful surroundings. It's just all I can say. It's just come out here and sit on the river and look up, and then catch some fish and look up some more and just listen to the water. And it's a lot of the therapy you get, no matter how much stress you're under. You can always come out and relax out here. Wonderful experience, and bringing the kids up here and camping and fishing with them and hunting, and the things that we did together were all outdoors. So all those memories we have surround this beautiful outdoor area. In 1999-2000, when we found out the problems that occurred as a result of the contaminated vermiculite, it's a hard one to bring any kind of understanding to. It's just such a contradiction.
Brad did the last year of his pediatric residency in Salt Lake City. We came to Libby in the summer of 1977.
1977, Libby had 5 physicians and no nurse practitioners, no PAs. And the town needed at least 10.
I came along with the internist, Richard Irons, and we set up a practice. His was internal medicine, mine was pediatrics.
I always remember all my friends as a kid saying, "Your dad saved me," or "Your dad did this or that for me." So he always just kind of made everyone happy.
We had the 3 kids. They got to grow up in this rural setting, and of course they learned to appreciate the outdoors and the things that we were able to do as they were growing up. And
we'd always go hiking, fishing, skiing. That was kind of a big part of our family.
Libby was just incredibly vibrant. You know, the timber industry was roaring. They completed the Libby Dam. The zonolite mine was also operating. You know, the town was just really strong economically, and it was just kind of one of those rough-cut towns. There's no welcome wagon in Libby. You got to understand. You come in and you have to earn your way into the community.
I liked Dr. Black because he was very calming as a professional. His demeanor was very good for the kids, and he could put everything in perspective, and you understood things when you left.
Vermiculite mining began just north of Libby, Montana in 1919, when prospector Edgar Alley started mining the ore on Zonolite Mountain. 44 years later, in 1963, W.R. Grace bought Alley's operation. Over the next 3 decades, more than 80% of the world's vermiculite came from Libby. But what the workers did not know was that Libby's vermiculite was contaminated primarily with windchite and richterite, and to a lesser degree tremolite. It all added up to a deadly form of asbestos.
Our family moved here in 1967, so I started 7th grade here in Libby. I was probably 20 years old when I went to work at the mine, and I worked there for 17 years till they closed. There was a lot of dust. I was up on the top floors, and you would brush that off the wire mesh of the screens, And the more you kept it clean, the higher your grade was. As it turned out, it was asbestos. The company would keep people on the books even though they couldn't breathe well. They would just have them come to work.
Leroy was diagnosed with chronic asbestos-related lung disease in 2001.
I was born in Libby in 1942. On my 18th birthday, I went to work at the vermiculite mine, and I did a variety of jobs, what they call mucking in the wet mill, where you shoveled ore that as it fell off the conveyor belts and built up on the floor. I went to work in the expanding plant down by the railroad, loaded boxcars with ore, bagged it, and it was a very dusty area. I had a father that worked at the mine also, and he worked there many years till he died.
David also has two half-brothers who died of esophageal cancer that was attributed to asbestos, and now David's lung functioning is in decline.
I was a gandy dancer. That's working on the railroad tracks. And I ran a lot of equipment on the railroad. And by doing that, I stirred up a lot of the ballast, that the asbestos that was hauled out of here on the railroad tracks. So you're breathing this stuff constantly. And it gets pretty dusty where it's pretty hard to see when you're looking out that window. I could see where it got my lungs so messed up is by breathing that all the time. And I'm never going to get rid of it. Nobody with this disease from around here, with this amphibole, will never be able to get new lungs.
Dan Busby passed away in 2022.
I lived in Libby from 1966 until 1997.
Asbestos was in the attic insulation of Angie's family home.
My parents both died from complications from asbestosis. We did fishing, swimming. We did a lot of outdoor things. I was exposed from that.
I moved to Libby in about 1962. We was not told at that time that it was anything bad. It was just dust. And that's just what Libby had all over the place. If you're playing baseball, there's times that you'd hit the ball and the ball would go through a dust devil. Well, you could see the ball go in, but you didn't know where the ball came out at. And so there's times we'd even have to hold off on the game to let the dust to settle down. My entire family's been affected by the asbestos, or asbestosis. It is what it is.
I've lived in Libby for over 75 years now. Well, my father worked at the mine. He developed a disorder that they referred to as a heart problem. He was 61 years old. He was unable to work. He couldn't breathe, and his lungs were completely full of asbestos. It was all through our house, it was in the car, it was everywhere. So it was just a matter of something that was wrong that had to be righted, and something that killed my father, my family. My brother-in-law died of meso, my mother died of asbestos. I got diagnosed during the screening. My husband had gotten diagnosed. Since then, 4 out of 5 of my children have been diagnosed. 9 out of 11 of my grandchildren started their first kindergarten at Plummer School. Their first day of latency is their first day of kindergarten. So we're looking at generational, this going on for a long time. My husband ended up dying 5 years ago of lung cancer. So, due to this.
In 1959, the family moved to Libby. When we were little, of course, the parents would get truckloads of it for gardens or whatever. And us kids would play in it, and we would hold a match under it to watch it open like popcorn. We would play with it quite a bit. There were 8 of us, children. And I remember as a kid I had chronic bronchitis. I had problems all my life with it. I mean, both of my parents died from this. In my family, of all the siblings, all of them have asbestosis to different degrees, except for one sister. So it affected our family greatly.
Karen was diagnosed with ARD in 2001. The disease refers not only to cancers like mesothelioma and lung cancer, but also to chronic and often progressive lung disease.
I lived here for 45 years in Libby, Montana. I started having a lot of problems with dust, and I worked in the post office. I did the maintenance, and it got to the point that sometimes I'd be talking and I'd just lose my wind, and I'd have to go sit in my pickup and use my inhaler and just let myself settle down so I could breathe again.
Ed was diagnosed with asbestos-related disease in 2012.
We're all affected by it, but I lost my younger brother, I think 11, 12 years ago. I think he was 57. Lost my mom about 3 years after that, and lost my dad 2 years ago.
We moved to Libby in '65. My husband went to work for the police department, and he would go down the alleys and knock on doors, and he breathed that every night. And it was just not good. You'd bring it home with you in your clothes.
Beverly's husband, Don, died in 2014. 1 year later, Beverly was diagnosed.
I started in the powerhouse shoveling chips. I worked on the dry chain and plywood, feeding the dryers, a little bit of everything, clean up, you name it, I did it. The kids would go over and play in the piles of zonelite, and we didn't know it was dangerous. All my kids have been affected by the asbestos. My oldest son died of cancer, and he died a horrible death. John is affected by it's in his lungs, and he has horrible coughing spells. I know that they're in a better place. They're not suffering anymore, but I miss them every day. I don't know, it's tragic. It was terribly wrong because they knew what was going on, but they chose to ignore it.
Attention all personnel, attention all personnel. Mill operations officially shut down.
Grace shut down the whole business because of the liability that they was afraid they would incur in the future.
As miners and family members became sick and began to die, lawsuits targeted W.R. Grace. They closed the mine in 1990. However, Grace hired former workers to tear down the buildings, which meant continued exposure to asbestos for the people of Libby.
There was the old wet mill, the old dry mill, and the transfer point, which was where the initial product was dumped by trucks. So all of that stuff had to be tore down. So there was 20, 30, 40 years of accumulation of dust that had been on all these beams and stuff like that.
Dust the workers and their families still did not know could be lethal and had spread throughout their community.
I didn't find out until I was out of the railroad. That's when the Seattle Post-Intelligencer came and opened up the can of worms of what's going on with W.R. Grace.
I was working at the Seattle Post-Intelligencer, and one of my duties there was supervising the investigative team. And chief among those in that team was Andrew Schneider. He was just a fantastic reporter. And he heard that there could be some people sick from a mine in northwestern Montana. He went there and found a story that basically had been untold for decades.
So we knew we then had a situation of a story where many, many people died, an enormously large number for the government, for any government, not to know about it. And we had the first documentable signs that Grace knew about it. As we dug deeper, we found that not only did Grace know about it, but the government knew about it.
At that time, asbestos-related disease was thought to be only an occupational disease. In other words, you could only get it if you worked around it or repeatedly and constantly exposed to it. Of course, now we know that's not true, and particularly with the Libby amphibole, which is so dangerous. There were no showers or changing facilities up there, and so their cars became dust bombs, and their clothing, of course, they brought home and their wives washed it and were exposed, and their kids were exposed. And we know now that the mine owner kept track, very meticulous track of the disease as it passed through the workforce.
When the whole story came out, it was unimaginable, the enormity of it and the hold that that company had over this town and the people.
They were poisoning the people and not telling them about it. W.R. Grace was working with the state. The state wasn't notifying the people. The railroad wasn't notifying its workers about the asbestos, and it just snowballed down the line. Everybody was out to make their own dollar, and heck with the worker.
If that story hadn't broken, more people would have died, and fewer people would have known what killed them.
I spent 10 years investigating homicides and rapes and crimes in Lincoln County. I should have been investigating the crimes that were occurring up on the hill.
There was a town meeting in the little high school gymnasium, which maybe holds 600 people, and it was packed to the rafters with people, many of them dragging their green oxygen bottles. And people stood up and tears streamed down their face, and they talked about the family members they'd lost and about their own illness.
I'm not really disabled, I just can't breathe if I don't have Grace, my good constant companion.
It was just an amazing moment where this little town basically confronted what was killing it.
Thanks, Heidi. Well, the governor has just wrapped up a very busy day.
When the stories broke, I was just devastated, thinking that here we are, we're the physicians that are taking care of the community, and we totally missed what was going on. We did not see it. That's probably the hardest thing, because we came out of training, with an idea that we're not going to see any asbestos disease.
The Environmental Protection Agency had listed asbestos as a hazardous air pollutant as far back as 1971, and the Occupational Safety and Health Administration established regulations to restrict exposure. But workers at W.R. Grace had not been told about the risks of working there because windchite and richterite were not included in the regulations.
What happened with our medical community, because we're so small, if you had a respiratory problem and needed to see a pulmonologist, you would get sent to Spokane or Kalispell. So it wasn't somebody in town that saw all this respiratory disease, so it didn't really get noticed.
I thought I better go meet with Dr. Whitehouse. He was a pulmonologist in Spokane that recognized that people in Libby were developing asbestos-related lung disease from environmental exposure in Libby. And so I went over there and spent time with him looking at cases, and I realized this. I just looked, I said, well, we would never have seen this. It's such a different pattern. Libby's was so different, and I just was like, man, I just knew how many of us had been exposed. It just makes you sick to your stomach.
Well, it's very sad. I mean, this is just devastating to this community. We're talking about an awful lot of totally innocent victims caught up in this that had no way of knowing what was going on unless somebody had bothered to tell them that it was a problem, and they didn't, of course.
Amazingly, the mine ownership controlled the hospital through the hospital board, and they had this X-ray program for their miners. They hadn't shared the results with either the miners or their families. But because of all of that, the words asbestos-related disease never appeared on a death certificate in Libby, Montana.
The Seattle PI's investigation showed at least 192 people had died from the exposure, and that 375 victims were living with the disease. Once the story made national headlines, federal government agencies headed to Libby to begin assessing the situation.
We investigated the former processing facilities, we investigated the mine. We immediately observed material that we suspected of being contaminated. In the first few days, we found examples of asbestos in very high concentrations laying throughout the former processing plants and accessible to the community of Libby. So people could, in fact, go and get this stuff. The kids could play in it. That was disturbing to us right off the bat. The assumption, of course, had been that these facilities had been cleaned up by W.R. Grace before they left, and that was not the case.
The EPA began the long haul of cleaning up the contaminated areas.
Sometime in, say, June, July of 2000, the light flashed on that, definitely that this was far longer, far bigger than we thought.
Asbestos-laced vermiculite was found everywhere, from homes, lawns, and gardens, to buildings, schools, and sports fields, and everything in between.
And gosh, they had these skating rinks around at each of the elementary schools where they bowled out, lined it with vermiculite tailings, and they would fill it with water. They'd pack it down enough they could fill it with water, and it would freeze in the wintertime and have a little skating rink. The day we went out to look at this place, there's 3 kids sitting on the sideline, and it's like their WWF arena.
Right.
And they're out there wrestling, trundling around this crap, and it's, again, asbestos tailings, vermiculite tailings.
More than 1 million cubic yards of soil would have to be removed and replaced, and more than 2,000 homes would need asbestos removal.
In terms of the number of people who are sick or have measurable signs of being exposed and harmed by this material, this place is unprecedented. You have to go to places like Turkey or third world countries to see this type of exposure to a population around a mine or a processing operation. It hasn't happened in the United States before like this.
By now, W.R. Grace was facing hundreds of lawsuits filed by Libby area residents, and thousands more from around the country. In 2001, Grace filed for bankruptcy. In 2002, Libby, Troy, and the surrounding areas were placed on the nation's Superfund list for environmental cleanup. The work is nearly completed, but asbestos-containing materials are still present, so the possibility for recontamination and exposures remain to a lesser extent. Education is key, because the material is also in tens of millions of homes and other buildings across the country where people don't know that a danger exists.
I worked on the screening protocol for the asbestos screening program that the ATSDR carried out in 2000 and 2001. The Agency for Toxic Disease and Substance Registry, they were involved in assessing the potential health effects from it.
We all work collaboratively with EPA and the state and the local. And we reviewed medical records, talked with the physicians, looked at x-rays, and said, my God, there's cases here that aren't work-related. What's going on? We screened the first summer about 6,200 people. And the following summer, we screened about another 1,100 people.
It was the largest health survey of its kind that the ATSDR had conducted in the country. And they discovered that more than a third of the town showed signs of lung abnormality, and indicating that either they had asbestos-related disease or were likely to develop it.
The exposures that we're seeing in Libby and the resulting disease and death there for a residential population, constitute one of the worst environmental disasters that have occurred since EPA was an agency. I don't think there's any question.
We felt the importance of bringing infrastructure that was community-based and accessible for people in Libby.
In 2000, the Center for Asbestos Related Disease, or CARD, was established as a department of St. John's Lutheran Hospital. Dr. Brad Black accepted the challenge to become CARD's medical director.
I just remember when he told me that this is what he wanted to do. I think the first question I had was, are you really sure you want to do this? Because I said, these people are going to get sick, and a lot of them are going to be your friends, and they're not going to make it. I said, are you going to be able to handle it? And he goes, yeah. He says, I want to do it. I want to help these people.
The original CARD goal at the time it was established was to help patients who were diagnosed with ARD.
And then obviously constant surveillance to make sure there's no ongoing exposures and trying to find effective treatments.
This is a different kind of asbestos fiber. This is an amphibole asbestos, we call it, and this is a unique exposure in the United States. We think that it creates more tendency to scar down the lining of the lung. What we want to try to do is understand if in fact that's true, why, and then certainly learn how to block that if we can. We'd certainly love to find some kind of therapy.
So these antibodies, I became involved with the CARD clinic in 2001. My first impression, honestly, of Dr. Black was to be very, very impressed because of his idea to create this clinic, to address this problem, to make serious advances toward understanding what was going on. He gave up a quiet, small community practice to take on a giant, and the giant being this disease and this exposure, and to try to help these people in a very, very big way.
The particular characteristics of this asbestos are they're biopersistent. That is, once you breathe them into the air sacs and they move to that lining, they're there. And we, as far as we know, they stay there for life. They continue to cause irritation, and in certain people, continue to cause scarring. If you look at this particular patient who has advanced asbestos-related disease, there's a significant line of white inside here. It's clearly the thickening of the lining of the lung. When this scarring occurs around the outside of the lung, it reduces the size of the lung. And if you look at this lung and look at the height of it, okay, and this is in a healthy lung right here, and then you look at this gentleman who has just lived in Libby and is now at the later stages of his disease. You can see the height of the lung from the diaphragm up, and you can see the significant difference in the height of the lungs. Here's a gentleman that probably has less than half of his lung function. Clearly there are people now with non-occupational exposures that have progressive lung disease, and I doubt they're going to enjoy normal lives. I think that their disease is progressing at a rate that's going to significantly limit them.
The evolution of the CARD clinic has been a trajectory of caring for the community. And even when there were community members who struggled to accept that something was going on in their community and were worried about economic impacts and all of that, what Dr. Black and the CARD clinic were able to do was educate as they went along, reach out to people. With Dr. Black.
The fact that he dealt with the community with the way he has and made people understand that this disease was real is such a big thing, because there were so many people that were misdiagnosed from out of the area because other doctors don't understand. They don't look for that. They don't look for the things that Brad looked for.
It's hard when I see my friends in here that have been affected, but also I also would hope that I'm doing what I can now at this point to help them and try to find some things that might help them better.
And it's the Libby human spirit that inspires me the most, to persevere, to work together, to courageously, good-heartedly, good, positive way. Dr. Brad Black, who's worked tirelessly to help serve the people of Libby, sometimes without the resources he really needs or like to have, but has done just a super job. And I take my hat off to Libby Montana, the courage of the people.
We worked toward putting a longer-term clinic together that would then do ongoing screening and monitoring and perhaps, hopefully, research into mechanisms of disease and potential therapies.
In 2003, CARD became a standalone, nonprofit, community-based organization. A volunteer board of community members was formed to oversee the clinic.
And since that time, we've expanded to the point where, the research has been an important function of the CARD and taking care of patients. And Dr. Black was immensely important in that role.
In 2009, the EPA declared a public health emergency in Libby, calling it the worst case of industrial poisoning of a community in U.S. history. As a result, CARD was able to secure research grants for several important projects.
So after a lot of discussions with Curtis, through my work with the CARD and with Dr. Black, we were able to validate the initial speculation that autoimmune disease was really a problem in Libby. And so we've been able to publish several papers on that. The second major step forward was the discovery of some autoantibodies that we believe are implicated in the lung pathology that they're seeing. That means that there's a really huge immune component to the lung disease that they're seeing in Libby. And then in our most recent paper, we were able to show that the rapid progressive disease is associated with the presence of those antibodies in the people in Libby.
I think through Brad's rapport with the people of the community that they trusted CARD, that people knew if they were going to volunteer to participate in some research, donate blood, tissue, x-rays, but they knew it was going to go for the right reason.
But because so many of the people in Libby have given permission for their samples and their data to be used for research, it also can become a much larger purpose registry for research. Dr. Black has always had this tremendous vision about what the CARD could accomplish.
Then we realized we've got to start doing more outreach related to this disease, which is very different when compared to the usual asbestos-related disease. And so we engaged first with Mount Sinai, and this came through a grant through the CDC that was targeted to understanding the toxicity of the Libby asbestos. And so we developed a research advisory group. And then there was Steve Levin, who was really became interested and came to Libby and looked at multiple cases here and realized this is so different than what they see in their steam fitters and those folks in New York that were exposed to the commercial asbestos.
It's been an incredible experience. We identified even what you could call a new disease where you get this progressive pleural fibrosis that may not necessarily give you cancer, but kills you from restricting your breathing. And these patients basically dwindle away. It's like a boa constrictor over a longer period of time. Little by little, your chest is contracting because of this pleural fibrosis. And then you can't breathe, you can't walk, you become incapacitated, and then you eventually die. That was a disease process that had not been described before. And all of this was based on the work in Libby, Montana. Brad and I were looking at films and sort of try and correlate what's going on with the clinical picture of the patient. And we found these consistent findings on CAT scan. But we're not radiologists. And so we thought, why not get the most pioneering radiologists in the world? So Claudia Henschke and David Yankelowitz basically invented CT screening for lung cancer. In 2006, they had a New England Journal of Medicine article that basically set CAT scan screening for lung cancer as the standard. So they came out to Libby, we went over things, and we've all been working together for many years now, trying to, number one, define this disease, number two, figure out how to try and prevent it, which is obvious, stop the exposure, and figure out what we can do once you have these findings to try and prevent the patient from not only dying but suffering.
What we added is our expertise in reading those CT scans and in providing a follow-up regimen for the findings. You want to make sure that no unnecessary workup is done, but still early findings are recognized and followed appropriately. The research that we've participated with Dr. Black really has shown that there are abnormal pulmonary function tests, that there are abnormal CT findings, and other findings such as pleural plaques, all of which relate to the amount of exposure that they had while working in Libby, Montana. They had different professions, they were of different ages. All of those factors we looked at in the various papers that we've participated in, as well as looking at the pathology findings, the findings at surgery that really confirmed the research findings.
Both Claudia and I have done a lot of academic work in terms of understanding how you look for subtle changes. The things that they were describing as subtle pleural plaques were real. They were genuine. And things we saw were correlating well with what they had found clinically in patients. Brad had become quite good at looking at the scans. You know, he had put together his clinical knowledge, and even though he's not a radiologist, he would look at all the scans, which is, you know, already a very good sign for a clinician to really not just take the report from a radiologist, but he has the background knowledge of what the patients are complaining about and where they're feeling. He knows what the potential treatments are, and he's very careful with these patients. He really follows them extraordinarily well. And you see that in the clinic also. The people there are dedicated. It's kind of extraordinary, really. You know, the level of dedication you see. They really care about these people.
Working with Dr. Black and his team was a wonderful experience because the enthusiasm that he engendered, the community outreach, hearing the individuals that attended his clinic in the various meetings was just really inspiring. To have that kind of relationship with the people in the town and with the team at the Card Clinic.
It's a little thin layer of soft tissue density between the rib and the lung.
I think he is creating total paradigm shifts in our understanding of asbestos diseases and finding this pleural thickening that is so unique. And that is what we think the autoantibodies contribute to, and that is what we think is this progressive, deadly component of the disease. They were spot on. They had the diagnosis spot on, and it was hard to do that, to get to that point where they had the diagnosis so pinned down. And I think that's a huge thing going forward, to be able to train doctors in the future to be able to look for this disease, because most doctors are not looking. So that's been the real vision of Dr. Black's that's going to revolutionize diagnosis and then treatment.
You know, there's lots of opportunities to do more research and to look for more potential treatments.
And so it's been a very productive working relationship, and it'll continue to be so.
I think the use of asbestos in the United States should be banned. When I read that it was not banned in this country, I couldn't believe it.
We founded ADO in 2004 when my late husband was first diagnosed with mesothelioma, and it was aggressive, deadly cancer. Alan was 63, and I thought it was outrageous to live in a country where we didn't even know the health concerns of asbestos, and worse yet, it hadn't been banned. We knew that we needed a strong scientific board, and Dr. Brad Black was one of the first doctors that joined us. He brought a wealth of knowledge. Everything led back to Libby. I was there when they were setting up the crosses. It was a staggering sight to see the cemetery with all of the crosses and the flags or ribbons on them. I saw all the patients' records in one of their rooms, and it was staggering to see the files and files of other people like Alan who had suffered. I saw how Dr. Black was able to interface with his patients. And he was able to demystify the disease, talk about a treatment plan, and help them to accept, or at least understand, their new normal. This is not a problem of Libby, Montana. This is a United States problem. Because contaminated vermiculite was shipped all across the United States.
And every place zonally it was shipped to by rail and then processed, people died. Railroad workers died, factory workers died, people who bought the product and put it in their attics died. There are still probably 15 million homes across the United States with the time bomb of zonalite insulation in their attics.
We still import it. People are still exposed to it. If there's a fire here in New York City, the firemen go out there and they have no idea what's in those walls, but they're ripping them down, and many times asbestos has fallen right on them. So we're putting our heroes in the most vulnerable position. And I think there's enough data out there, based on the work of Brad Black and others, that we can ban asbestos in the United States.
In 1989, the EPA instituted a partial ban on some asbestos-containing products, but many Americans mistakenly believed that asbestos was a thing of the past. Without a complete ban, many products containing asbestos will continue to be imported. More than 70 countries around the world have banned asbestos, but the United States is not yet among them.
You know, it's been a long legislative grind, and Linda Reinstein with the Asbestos Disease Awareness Organization has played a huge role in educating Congress.
We have learned from Libby, watching that tragic story play out, that you have to embrace prevention to eliminate all asbestos-caused diseases.
Dr. Black has worked hard to help heal this community, and the impact is more than he realizes, for sure. We've gone from everybody being afraid and confused to people really understanding that CARD is here and their healthcare needs will be addressed.
Since its inception, CARD has screened nearly 8,000 people and has diagnosed more than 2,800 of those patients with asbestos-related disease. It's the only centralized clinic in the nation where patients can go to receive help with all facets of this disease.
CARD has a screening grant from the CDC. When you come through screening, you get a chest x-ray and you get a spirometry, which is a simple breathing test. Once you're diagnosed, you do a full breathing test. We have a social worker, we have nurses, we have doctors, we have respiratory therapists. We have a whole team of people that are just here to help.
I help them in a way that I'm a respiratory therapist, and I can help them, learn different ways of breathing, teach them how to use their medications just right. But we're a support system, and they feel like they can come to CARD and we'll at least be there for them.
I've seen the way CARD clinic staff interact with the patients, and it's amazing. And Dr. Black understood the disease from a medical standpoint. He understood that there were more victims to come. He understood that the latency period just is such an immensely complicating factor. And he also understood symptomatically the progression of the disease, whether we're talking about asbestosis or mesothelioma or lung cancer. He knew what people would need from a clinical standpoint, from a human standpoint of care, and did his level best to make sure they got it.
It is important to have CARD here because we provide a quality of care for people who are experiencing a slow motion disaster. We're holistic, and we provide the upfront medical care and also psychosocial care, and people need that when we're diagnosing every single day. We have been following these people since the day they were diagnosed.
Part of the problem is the lack of people understanding the disease process.
For nearly 20 years, CARD has been hosting research meetings and symposiums about Libby, gathering people from around the world to discuss the Libby amphibole and asbestos-related disease. CARD also attends and presents at major medical and public health conferences throughout the country.
See, these are the different things in here.
The CARD Clinic has been engaged with patient education from the very beginning, creating a very dynamic website with educational materials.
I just can't say enough about how great the clinic has been and what a hero I think Dr. Black is. I mean, Brad stood up and did the right thing.
He cared, you know, that when it got hard, he didn't walk away. He loves his community, he loves his people, and he kept going when everybody else said, leave it alone, so.
I think that we're trying to create hope and a way forward. And so treating the patients and then also getting the word out that, you know, yes, there is some disease, but it's under control and it's a good place to visit. And so we're at the same time as trying to help the people in need, we're also trying to help the community recover. One of the things that the whole community and CARD are trying to improve is people understanding that Libby is safe. It's been safe for many years now.
I think only positive things about the future here. It's transitioned into more of a tourist-based economy. More and more people are moving to the area as well, so it's going to change the community a lot.
Libby is definitely nature's playground. We're on millions of acres of open recreational lands. Number one is hiking for sure, but we get avid cyclists that come through, avid mountain bikers, some kayakers. When you do come for all the landscape beauty and recreational opportunities, you find so many incredible, unique businesses in our town that really just add to the charm. I love the community. Everyone here is so friendly and so welcoming, and I've never been to a small town that does so much. I love small town living, but in the summer we have something major going on almost every weekend, and our community is very active and works together, so there's always something to do, always friendly faces.
I think that Dr. Black needs to be remembered as the person who brought the community together to create something out of tragedy.
From the start, his interest is in his patients. His interest is in the science. He has incredible credibility and integrity, not just in Libby, but certainly across the asbestos related disease community. He's been recognized for being a public health hero, and I think that there's no question about that.
You're never going to find a more compassionate person than Brad. He's given 100% of his life to this, you know, and kudos to him.
Dr. Black is a unique individual. He is a mixture of pure, innocent, all-American doctor combined with a relentless fighter for people who can't fight for themselves. He's one of these guys that just wants to try and do the right thing, period. And I think that has defined his entire life. And he's just someone I have a huge amount of respect for. Because of Brad Black, we have a better understanding of the disease process in Libby. And because of his work, I think he has saved lives, and in the future more lives will be saved because of the work that he's done.
Brad has stepped up to rescue this community so many times, and he's never really gotten credit for it. But those of us in medicine, we know who stepped up.
Dr. Black is now retired from patient care, but he has no plans to step away entirely from the CARD Clinic.
I might join it. Yeah. I'll keep doing research because I would really like to solve some of these other issues that I think are important, and we have a population that's unfortunately, you know, become the laboratory for understanding more, and hopefully we can do something good for somebody with this in the form of therapy, and that would be something that would make me very happy.
What I would hope people remember is his commitment to the community and his appreciation for everybody in it.
I really don't think that we would be where we are if it wasn't for Dr. Black. He is really the one that has really went above and beyond what he needed to do to help the victims of this community. I'd like to see him live another 60, 70 years.
I think he'll, years from now, will be looked at as a pioneer in hopefully the eradication of the disease. The time he has given to this community, they can never repay him enough. I can't speak highly enough of him.
In 2022, with bipartisan support, the Alan Reinstein Ban Asbestos Now Act was introduced to Congress. If enacted, it would ban all importation and commercial use of raw asbestos and asbestos-containing products in the United States.